Did you ever wonder why some people still say a dog is trying to dominate you when the dog growls, guards food, or becomes aggressive towards an owner? This is one of the most persistent myths in dog behavior. And it's not harmless. In this video, I want to explain where the dominance theory comes from, why it became so appealing, and why is it scientifically and clinically flawed, and why it can pose a real risk for both dogs and people. Then I will explain how dogs actually attach to their owners, how we should address problems that may look like dominance but usually means something very different. My name is Sagi Denenberg, and I'm a veterinary psychiatrist helping dogs, cats, and their owners. Dominance theory did not appear out of nowhere. It came partly from early observation of wolves, especially captive wolves, living in artificial groups. These were not natural family groups. They were unrelated animals placed together, often in restricted environments where conflict was more likely. Researchers observed competition, aggression, and hierarchy, and control over resources. From that, the idea developed that wolves live in strict packs led by an alpha who maintains control through force. Then people applied that idea to dogs. The message became simple. Dogs are pack animals. Your family is a pack, and your dog is constantly trying to climb up the hierarchy. If the dog growls, guards food, refuses to move, or shows aggression, the explanation was often the same. The dog is trying to dominate you. That message spread through books, television, and popular training cultures, and it became appealing because it gives people a simple answer. The dog is not anxious, it is not confused, the dog is not afraid, the dog is not struggling with the situation, the dog is just trying to be the boss. That sounds clear. It also gives simple solution. Take control, be firm, show the dog who's in charge. But simple is not the same as correct, and confident is not the same as evidence-based. The first problem is that dominance theory was built on poor models. Natural wolf groups are usually family units, not random groups of animals fighting for power. The old idea of alpha wolf ruling through constant aggression is not an accurate model of normal wolf social life. The second problem is that dogs are not wolves. Dogs have been domesticated for thousands of years. Their behavior, social relationship, communication, and attachment to people are not simply wolf behavior moved into the house. And the third problem is most clinically important. Dominance is often used as a label before proper assessment. A label is not a diagnosis. When a dog guards food, growls from the sofa, or becomes aggressive towards an owner, dominance theory gives one explanation. The dog is challenging authority. But these behaviors can have many different causes. The dog might be protecting something valuable. He might be uncomfortable with being touched or moved. He may have learned that people approaching predicts conflict. The dog may be frightened, frustrated, or physically uncomfortable. The dog might have a history where warning signs were ignored or punished in the past. The point is not to guess. The point is to assess. Calling a behavior dominance explains almost nothing. Worse, it changes how the owner sees the dog. The dog becomes defiant, the dog becomes calculating, the dog becomes disrespectful. And once the owner sees the dog in that way, the response often becomes confrontational. That is where the risk begins. Take the classic example of resource guarding. A dog has food, a chew, a toy, a resting place. The person approaches, the dog often stiffens, freezes, lowers its head, eats faster, moves over the item, or growls. Dominance theory says, take the item away and show him it belongs to you. The advice can be dangerous. The growl is not a power move. The growl is communication. It means, I'm uncomfortable. Please stop, give me space. If the owner punishes the dog for growling or forcibly removes the item, the dog may learn that people approach really are a threat. It may also learn that growling does not work. That can make the behavior worse. Next time, he may escalate faster. He may snap or bite without warning. The same problem happens when a dog growls while being moved from the sofa, the bed, a crate, or a resting place. The dominance explanation says he thinks he owns the furniture. But the better clinical question is, why does this interaction feels unsafe or difficult for my dog? Is the owner grabbing, punishing, or pulling the dog? Does the dog understand what it's being asked? Is the resting place valuable? Is there discomfort with handling? Has this situation become repeated conflict? Those questions lead to a safer treatment. Instead of grabbing the collar or forcing the dog off the sofa, we can teach a clear off or come cue, reward the dog for moving, provide an appropriate resting place, and change the interaction from confrontation to cooperation. That is not being permissive, that is being precise. Now, consider aggression towards the owner. This is where dominance theory becomes especially harmful. When a dog growls, snaps, or bites a family member, some people immediately say, this dog is dominant. But aggression is not a personality type. Aggression is a behavior, and behavior has a context, triggers, motivations, learning history, emotional states, and sometimes physical contributors. If we reduce aggression to dominance, we miss the real problem. And when we miss the real problem, we choose the wrong treatment. That can harm the dog. It can worsen aggression, it can damage relationship, and it can put people at risk. One of the most dangerous ideas from dominance-based thinking is that the owner must confront the dog, pin the dog down, roll the dog over, take the item, force the dog off the furniture, stare the dog down, make the dog submit, and more. These methods can temporarily suppress the behavior, but suppression is not treatment. It's just scaring the dog. A dog may stop growling because it's afraid. This does not mean it feels safe. This does not mean the motivation is gone. This does not mean the risk is lower. In some cases, the risk is higher. It's higher because the warning signs are reduced. This is why assessment must come before treatment. We need to ask, why is this behavior happening? What is the dog trying to avoid, protect, access, or communicate? What has the dog learned? What is the risk to people and other animals? And what can we change safely? Dominance theory fails because it starts with conclusion before doing the assessment. It assumes motive. It blames the dog. It often turns the owner into an opponent. That is the opposite of good behavioral medicine. Does this mean dogs have no social structures? Of course not. Dogs are social animals. They learn from consequences. They compete for resources. They form relationship. They can use aggression successfully if aggression works. But that is not the same as saying your dog is trying to become the leader of the household. Most behavior problems are not about rank. They're about emotions, learning, safety, predictability, resources, health, and communication. So I promise I tell you how dogs attach to their owners. A better way to understand many dogs is through the lens of attachment. Dogs can form strong attachment to people. The owner can become a source of safety, predictability, comfort, and guidance. In attachment language, the owner can act as a secure base. That means the dog feels safer exploring the world, coping with stress, and recovering from difficult events when the owner is calm, predictable, and responsive. This does not mean the owner lets the dog do anything the dog wants to do. A secure relationship has structure. It still has boundaries, it still requires training and management. But the foundation is not intimidation. The foundation is trust, consistency, and clear communication. A dog that trusts its owner is more likely to look at its owner for guidance. A dog who fears the owner may obey in some situation, but this is not the same thing. Fear can create silence. It does not create emotional stability. It can lead to more aggression. So when the behavior appears to be dominance, ask a better question. Do not ask, how do I make him submit? Ask, what is triggering the behavior? What is the risk, and what does this dog need to learn or feel differently? Do not ask, how do I win? Ask, how do we make this safe, predictable, and treatable? That shift matters because the treatment changes. For guarding, we use management, control setup, exchange exercises, and teaching the dog that people approaching predict something good rather than a loss. For growling when moved, we stop physical confrontation, we teach movement cues, we reinforce cooperation, and change how people interact with the dog during rest. For aggression towards owners, we need proper behavioral assessment, safety planning, physical evaluation, and individualized treatment plan. Sometimes that includes behavior modification. Sometimes medication is appropriate. Sometimes pain management is essential. Sometimes the environment must change. Often, several things need to be achieved together. That is why generic dominance advice is so weak. It gives the same explanation to different problems and then it gives the same treatment to different dogs. That is not clinical thinking, it's a shortcut. And shortcuts are risky when aggression is involved. The truth is that dogs do not need owners to act like a pack leader. They need owners to act like clear, consistent, safe, informed human. They need structure, but not intimidation. They need boundaries, but not confrontation. They need training, but not force. They need owners who understand that behavior is information. Growling, guarding, snapping, snarling, barking, those are all signals that provide information. The job is not to silence the information. The job is to understand it. Dominance theory is appealing because it's simple. But dogs are not simple machines trying to take over the house. They are animals with emotion, learning histories, physical needs, social relationship, and individual differences. When we replace dominance with proper assessment, we stop asking who is in charge and start asking what is actually wrong. That is how we protect people and dogs. And this is how we get better outcomes. If your dog is growling, guarding, snapping, or biting anyone in the home, do not treat it as dominance problem. Start with your veterinarian. Get pain and other physical condition considered. Then work with a qualified professional who can properly assess the behavior and develop a safe, evidence-based plan. And if you want more information, subscribe.